Good afternoon, everyone. My name is Rose Gino Caesar. I'm doing this video for health assessment class, and today I'm going to perform an abdominal assessment on my doll here. Her name is Dolly. Well, I named her Dolly. Okay, so we're going to start. I'm going to wash my hands. Good morning, Mrs. Dolly. My name is Rose. I'm going to be doing an abdominal assessment on you. Is that okay with you? Good. First, I would always inspect first. Look at the abdomen and assess for any abnormality, any distension, any lump. Look at the skin to see if there is any discoloration in a particular area, and then I would proceed with the rest of my assessment. So I'm looking at the abdomen to see if everything looks good. There is no abnormality so far. Then I will start with the auscultation of the abdomen. I'm going to move Mrs. Dolly's hands away from the abdomen so I can have enough space to work with. Okay, so first I'm going to auscultate for bowel sounds. I'm going to auscultate the 4 quadrant of the abdomen and also the rest. Okay, first I will start at the right upper quadrant, then the left upper, left lower, and right lower. I'm listening for any hypoactive or hyperactive sounds. If the patient is constipated or has diarrhea, I will ask also the patient if when was the last time you moved your bowel and all of that. Now that I'm done auscultating for the bowel sounds, I would go ahead and listening to for any bruit. A bruit is an abnormal sounds that can come from abnormal blood flow to an area. It can indicate that a blood vessel is either constricting or dilating. So I'm going to listen to a bruit for the aorta, right in the middle right here. Then right renal to see if there is any abnormal blood flow to the renal area. Left renal, right iliac, left iliac, right femoral, left femoral. Now that I found out there's no bruit, I can go ahead and start palpating. I'm palpating to see if there's any lump, if the patient is guarding when I do palpation, which would indicate that there is a problem to that area, like pain or tenderness, or if it's hard to touch, if it's hard like a hardboard, or if it's too soft. So we're palpating for all of that. So I'm going to start first at the right upper quadrant. I'll do light palpation first, then I'll do deep palpation. Okay, now that I'm done with my light palpation, I'm going to palpate for the liver to find out if there's any liver enlargement. So I'm going to turn my patient slightly to the left, and then I'll palpate like this. Okay, I'm done palpating for the liver. There's no enlargement. I didn't see anything abnormal. Now I'm going to palpate for the kidneys. Okay, I'm going to turn the patient, palpate the kidneys, and then to the side. And now that I'm done palpating, I can go ahead and percus. I'm going to percus the liver to see if there's any dullness. I can also percus the abdomen for any tenderness, any dullness in the area. We would indicate an abnormality. Right upper. Now that I'm done percussing, I can look for ascites. I can look for ascites 2 ways, either by percussing or by doing the waveform, where you move the abdomen from one side to the other, and you would see the wave that the abdomen is forming, which would indicate presence of ascites. Okay, now that I'm done, Mrs. Dolly, thank you for your cooperation. I'm done assessing your abdomen, and see you next time. Thank you for watching. Bye.